We were very excited to have our first drug approved for primary progressive MS, ocrelizumab. And it was exciting because we had no drug that had shown efficacy in progressive MS, particularly primary progressive MS. Now, as we've looked at that data a little bit more, we've come to appreciate that the type of patients that benefit from that drug are patients that are younger, earlier disease course, and less disabled. And when we've looked at that trial data a little bit more, those who are older, longer disease duration, and higher in the amount of disability tend not to benefit from the drug so much. And indeed, in clinical practice, as we've used that in patients without active inflammation, I've been a little bit disappointed that it hasn't done as much as we had hoped. So what's become clear to me is that there still is a great opportunity to find therapies for progressive MS. And probably those therapies have to look at not just the immune system, although we still need to turn off the immune system in progressive MS, but looking at what is driving that gradual little by little progression, which most likely is on a degenerative process sort of line, neurodegeneration, mitochondrial dysfunction, and looking at therapies that can not only stop the inflammation, but also slow the neurodegeneration that is probably driving the progression in progressive MS. So right now, I primarily use ocrelizumab in patients who have evidence of active inflammation and or are young. In patients who are older, who haven't had active inflammation, I worry about the risk of ocrelizumab being greater than the benefit that they might get. And so right now, the older patients, those with longer disease duration, I really don't have an effective therapy to slow down that insidious decline in their function. Keep in mind, ocrelizumab has a risk. It increased rates of respiratory infections, increased rates of shingles. So there are risks that this drug has that we need to balance, particularly if we don't think there are particular benefits that the drug is giving. So right now, there is a lot of patients with both primary progressive and secondary progressive MS that I don't have an effective treatment to help them. So there are several drugs that are in development for progressive MS, both primary and secondary progressive MS. I was involved in a phase 2 trial of ibudilast in both primary and secondary progressive MS that showed great potential in slowing down the progression of whole brain atrophy. We expect soon results from a couple progressive MS trials, including one looking at high-dose biotin and whether that slows down the progression of disability or in fact improves the function, the level of disability in patients with progressive MS. So there are treatments that are in development at different stages, and to me the most exciting ones are the ones that are not trying to modify the immune response, but rather looking at other mechanisms, the metabolic cascade, neurodegenerative pathways, mitochondrial dysfunction, things like that that are, in my view, more likely to be driving the disease than active inflammation.